Hello everyone, this is Dr. Adel Bondok, Professor of Anatomy and Neuroscience, Mansoura University, Egypt. I am going to talk about the hip bone. I will talk about the gross features and the special features. Okay, the hip bone is a regular bone. It is formed of three parts. The upper part is the ilium. The lower and the anterior part is the pubis. The lower and the posterior part is the ischium. The three parts meet at the acetabulum, where the three bones are separated by tri-radiate cartilage, which ossifies at the age of 12 years. Regarding the pubis is formed of body, superior ramus, and inferior ramus. The ischium is formed of body, ischial tuberosity, and ischial ramus. Okay, so the ilium is the upper part, pubis is the lower and the anterior part, ischium is the lower and posterior part. Regarding the ilium, it has four borders: upper border, anterior border, posterior border, and the medial border. This is the outer surface or the gluteal surface. The upper border is called the iliac crest. The iliac crest has outer lip, inner lip, and the intermediate area. And the outer lip has tubercle here for the iliotibial tract. The anterior border has anterior superior iliac spine and the anterior inferior iliac spine. The posterior border has posterior superior iliac spine and the posterior inferior iliac spine, and forms part of the greater sciatic notch. The gluteal surface or the outer surface has three gluteal lines: posterior gluteal line, middle gluteal line, and the inferior gluteal line. Okay. Then the pubis. This is the body of the pubis. The upper border of the body is called the pubic crest, which ends by pubic tubercle. Superior pubic ramus has pectineal surface and the pectineal line, and the inferior pubic ramus, which fuses with the ischial ramus to form the pubic arch. This is the ischium. It is formed of body, ischial tuberosity, and ischial ramus. The body has ischial spine. Above the ischial spine, greater sciatic notch. Below the ischial spine, lesser sciatic notch. The ischial tuberosity is divided into upper quadrangular area and lower triangular area. The upper quadrangular area is divided into upper lateral part and the lower medial part. The lower triangular area is divided into lateral area and the medial area. This is the acetabulum. The acetabulum is divided into, has three features: acetabular fossa, articular surface or leonate surface for the articulation with the head of the femur, and acetabular notch. This acetabular notch is converted into foramen by the transverse acetabular ligament. This is the inner surface of the hip bone. Okay, this is the ilium, upper part, pubis, lower and anterior, ischium, lower and posterior part. And regarding the ilium, upper border, anterior border, posterior border, and the medial border. This medial border is called arcuate line. This arcuate line divides the inner surface of the ilium into iliac fossa above the arcuate line and the sacropelvic surface below the arcuate line. The sacropelvic surface is divided into three parts: iliac tuberosity, upper part; auricular surface, middle part, for the articulation with the sacrum; and the pelvic surface, lower part. This is the pubis, body, superior ramus, inferior ramus, and this is obturator groove. The superior ramus has pectineal line and the pectineal surface. The body, the medial surface of the body, is the symphysial surface for articulation with the opposite hip bone to form the pubic symphysis. The inferior pubic ramus fuses with the ischial ramus to form the pubic arch. This is the ischium, body of the ischium, ischial tuberosity, ischial ramus. This is ischial spine, greater sciatic notch, and lesser sciatic notch. How to identify the side of the hip bone? Is it right or left? Okay, you have to identify three directions. The iliac crest is directed upward. Okay, the pubis, the acetabulum is directed laterally, and the pubis is directed anterior. Therefore, this one is the left hip bone, and this one is the right hip bone. Articulations of the sacrum of the hip bone. Articulation of the hip bone. First articulation was the opposite one to form the pubic symphysis. This pubic symphysis is secondary cartilaginous joint. Second articulation was the sacrum, ilium and the sacrum. This is the sacroiliac joint. Sacroiliac joint is plain synovial joint. It permits gliding movement. And this one, acetabulum and head of the femur. This is the hip joint, which is ball and socket. The ball is the head of the femur. The socket is the acetabulum. Regarding muscle attachment, muscle and ligaments, we have a rule here. Any projection gives the attachment to muscle and the ligament. So what are the projections here? Anterior superior iliac spine, anterior inferior iliac spine, posterior superior, posterior inferior iliac spine, pubic tubercle, ischial spine. Each one of them gives the attachment to muscle and the ligament. Anterior superior iliac spine. Name the muscle. The muscle is the sartorius. The ligament is the inguinal ligament. So anterior superior iliac spine, sartorius, and the inguinal ligament. How about the anterior inferior iliac spine? Anterior inferior iliac spine, the muscle is the straight head of rectus femoris. The ligament is the iliofemoral ligament. How about the posterior superior and the posterior inferior iliac spines? The muscle is the gluteus maximus, and the ligament is the sacrotuberous ligament. How about the pubic tubercle? Muscle and ligament. The muscle is the cremaster, okay? Muscle is the cremaster. How about the ligament? Ligament is the inguinal ligament, the medial end of the inguinal ligament. How about the ischial spine? Muscle from the inner surface or pelvic surface, levator ani. Okay, ischial spine, levator ani and the coccygeus. How about the ligament? Sacrospinous ligament. So any projection gives the attachment to ligament and the muscle. Anterior superior iliac spine, sartorius and the inguinal ligament. Anterior inferior iliac spine, straight head of rectus femoris and the iliofemoral ligament. Posterior superior and the posterior inferior iliac spines, gluteus maximus and the sacrotuberous ligament. Ischial spine, levator ani and the coccygeus, and the ligament is the sacrospinous ligament. Pubic tubercle, cremaster muscle, and inguinal ligament. Then ischial tuberosity. The ischial tuberosity is divided into upper quadrangular area and lower triangular area, and each area is divided into two parts. Upper quadrangular area is divided into upper lateral and lower medial. Okay, start by the pubis. This is the body of the pubis. The body of the pubis gives attachment to two muscles. Adductor longus from the outer surface and levator ani from the pelvic surface. This is the body. Superior pubic ramus, pectineus muscle. Inferior pubic ramus gives attachment to gracilis, adductor brevis, and adductor magnus, the pubic part of adductor magnus. So muscles attached to the pubis, the body, adductor longus outer surface, levator ani pelvic surface. Superior pubic ramus, pectineus. Inferior pubic ramus, gracilis, adductor brevis, pubic part of the adductor magnus. Regarding ischial tuberosity, upper quadrangular, lower triangular, upper quadrangular, upper lateral, lower medial. Okay, upper lateral part, semi-membranosus. Lower medial part, two muscles, semi-tendinosus and long head of the biceps femoris. Then the lower triangular area. This is the lateral part, ischial part of the adductor magnus. This is the medial part of the lower area. It is subcutaneous. And we have lateral border and the medial border. The lateral border is quadratus femoris. The medial border is the sacrotuberous ligament. Then muscles attached to the gluteal surface of the ilium. Four muscles attached to the gluteal surface of the ilium. The first one, gluteus maximus, behind the posterior gluteal line. This is the area for gluteus maximus. Then gluteus medius, area between posterior gluteal line and the middle gluteal line. Then gluteus minimus, area between middle gluteal line and the inferior gluteal line. Then reflected head of rectus femoris, impression above the acetabulum. Tensor fascia lata behind the anterior superior iliac spine. So four muscles attached to the gluteal surface, gluteus maximus behind the posterior gluteal line, gluteus medius between the posterior gluteal line and the middle gluteal line, gluteus minimus between the middle gluteal line and the inferior gluteal line, and the reflected head of rectus femoris, impression above the acetabulum. These are the two heads of the rectus femoris. Straight head from the anterior inferior iliac spine, reflected head from impression above the acetabulum. And thank you very much. Best wishes and good luck.